Hello, Elizabeth, Dr. E. Carter, PhD, your host of the Elevate Your Value Summit and your host of the Elevate Your Corporate Value podcast with Dr. E. I am so excited that I have been focusing on the co authors in my book, Letters to My Corporate Sisters, Volume 2, Stories of Endurance, Elevation, and Encouragement. I have with me here today Dr. Stella Obilor. And Stella has more letters after her last name than the alphabet. So I want her to be able to introduce herself and share with us those recognitions that she has. Dr. Stella, welcome.
Thank you, Dr. E. And I would say I'm privileged and honored even to make it through to this list of yours. So being one of the co-authors, that is a privilege I don't want to take for granted. And thank you for bringing our passion, showcasing that to the spotlight, because many of us wouldn't have had the opportunity to, help others, impart others with our inspirational, I would say, the steps we have taken to get to where we are today. So thank you again. And like Dr. E already introduced me, I'm Dr. Stella Onuoha-Obilor. And as a physician, I'm very proud that not just being a clinician, but I've done so much work within the population health space. So I have master's in public health. I also have doctorate in public health. As a matter of fact, I'm a certified case manager and also a certified professional in healthcare quality because I love to improve health outcomes. I love to help people live healthier lives. And I also love to create remarkable health experience for people to ensure that people access healthcare when they should, and there is no barriers, irrespective of their socio-economical class, irrespective of their gender, color, where they come from, or the zip code where they live. I believe so much in reducing health disparities. So with that, I did this certification with Harvard School of Public Health that I cherish so much, and it's on the use of data to improve health outcomes. And again, I'm someone that I love processes because I know by the time that you streamline processes, by the time that you reduce redundancies, people are ready to work on top of their licenses. So I have Lean Six Sigma, Green and Black Belts. I cherish those two certifications because they helped me to know how to manage processes. So as a physician executive, I've been in quality space for more than 18 years, doing work in around and within population health management, looking at data to convert data into actionable insights that will help people live healthier lives and be there for their grannies and be there to see the graduation of their children and also to take good care of themselves and enjoy the fruits of their labor in good health. So this is something I'm very passionate about. So thank you again so very much for giving me the platform to showcase that passion that I have behind the data that is happening within the healthcare industry.
Wonderful. Thank you so much for sharing. And my audience, you can hear the passion in her voice when she talks about this. This is something, and we all should have that one thing that we can talk about all day, every day, with the same sense of a smile, a same sense of purpose, being able to serve. So I love that you are involved in the healthcare space. And when we think about elevating the value of others, what really got you into the healthcare space, especially the data and the quality
Oh,
space?
thank you, Dr. E. I will tell you what that really wake I would say what that fuels my passion every day that I wake up to do what I do, especially in this space, is the passion I have for improving health outcomes. And my why is to ensure that I develop initiatives, programs that will help people change their lifestyles, that will help people live healthier lives. Because I know that prevention is cheaper. I know that prevention is better. Nothing is wrong about treating diabetes, right? But I believe that if I can catch someone who is at pre-diabetic stage and help to stop that person going into diabetes, that gives me more happiness and joy because I know there are complications that come with these chronic conditions. So I love that I am in this space because I believe so much that behind every data point is a human story. So for me, data, it's not just numbers. These numbers are people, spouses, siblings, friends, co-workers, right? I see them as parents behind those numbers. So when I work with these numbers, I give it my best to ensure that everyone that I have to touch or develop initiatives that will help them live their healthier lives, even if it's just one life that I save doing what I do, it's priceless.
I love that. I love when you said every data point has a story behind it.
Yeah.
I love that because we think a lot of times about data and we think, oh, it's just numbers. But every
Mm-hmm.
single person creates that data element that allows folks like yourself to really analyze and let people truly understand what's going on. So I
Yeah,
love that you love being in that space and helping people realize that they're not just a number. They're not
exactly.
just a member number or a patient
Exactly.
number or a hospital bed. They actually are human beings. And it
Mm-hmm.
really is that we're all ultimately in the caregiving business, ensuring that people ultimately can live their best life. Thank you for that.
You're welcome.
And if you haven't noticed, we can hear that Stella is probably not from the US. So Stella, tell us a little bit about where you're from and what are some of the differences, especially in the healthcare space, now that you've been here, that's different from back home.
Oh, thank you. That's a very good question. Originally, I'm from Nigeria. Nigeria is in West Africa. So when I got here, I will tell you that it was a shock for me at the beginning, right? Because initially back home, I was thinking when I got to America here that there wouldn't be health disparities, that people would do what they're supposed to do, close all their care gaps, do all their preventative screenings, even though there are huge differences between here and home where I come from, because most of the health insurances that you have here that can cover your medical and dental or even ophthalmic coverage, right? Like the vision, most of people back home pay out of pocket. They'd have nothing like health insurance. And for that reason, people only go to see doctor when they are sick. They don't really go for routine annual checkup, wellness visits, doing your dental cleaning or eye checks and all that. Because it's a lot of money to pay out of pocket. So when I came here, I realized that, oh, that's a huge difference. And because of that difference, you find out that even practicing back home, sometimes I see people come in when they're already, they come in, they have had stroke. And that is the first time they will know that they are hypertensive. But they've been hypertensive over the years without knowing. It's not that they don't like themselves or they don't want to get treated, but because of the huge cost of care, right? Because you have to pay out of pocket. So now getting here that I see that people have coverage, whether it's from their employer, whether it's from state Medicare or Medicaid, and that allow them the privilege and opportunity to go see their doctors, do their preventive screenings, whether it be mammogram, colonoscopy, or whatever the case may be, or even those that are managing their chronic conditions, right? They have follow-up follow-ups with their physicians to get them managed well. That is a huge difference between here and home where I come from. Because most people that even they have chronic conditions, they're not well managed. And for that, you see very end stage complications coming in, or even very young people coming down with this cancer that could have been prevented. And again, fast forward being here in the United States, it's not like all things are working the way it should. Care here is still complicated, disjointed, fragmented, difficult, expensive. So I'm beginning to realize that there's still gaps to close, especially when it comes to population health management, right? You can see people with strong um, history of cancer in their family. Like even one example I have always shared and I'll continue to share, it's when I was working in a non-invasive cardiology office, I came across a woman, 42, 43-year-old woman with strong history of breast cancer. Mom died from it, and one of the siblings also died from it. But at that age, she hasn't even had her baseline mammogram. I've said, no, that was really a gap right there. Because finding out these things at early stage, when they are treatable, is the key, is the goal, right? Not that we are saying people may be afraid to find out, but I always tell them, it's better you detect cancer when it's treatable as versus when it's already end stage. Imagine someone who detects breast cancer when it's at early stage can benefit from surgery and chemotherapy. That person can survive it. But if it's found out or detected when it's already gone to, when we call it a metastatic stage, meaning that the cancer has spread through all the body, at that stage it becomes difficult to treat. So those are the differences that are here that I can speak about, coming from Nigeria, having practiced in Nigeria, coming here. There are still disparities here, healthcare disparities, social determinants of care are still factors that has to be taken care of for people here also to utilize healthcare and have quality healthcare that will help them live the healthier lives that they want to live. Yeah.
Thank you. And for those of you out in the audience, hopefully you have your pen and paper, you're taking notes. Family history is an indicator.
Yeah.
If you know, a lot of times, as far as many people, they don't know their parents didn't really talk about what was wrong with them, because back in the day, they didn't want to go to the doctor. They were afraid. And then when they pass away, they want to kind of get everything cleared up and done. And you don't necessarily know what was their history. So those of you out in the Elevate Your Value audience, if you know your family history, don't think it skips a generation.
Yeah.
Go ahead and get checked just in case. I will say personally, my father's mother died of colon cancer. I knew that early on, and I've been getting colonoscopies since I was 40 because of that family history.
Yeah.
My father never had it. It did skip him for some reason,
Mhm.
but I want to keep abreast of that. Also, with both of my parents recently passing away, I went and got every test. Whatever they had wrong, I said, I want to get tested for that because it is hereditary.
Mhm.
So I thank you for that. And of course, we take our healthcare for granted.
Yeah.
We get it not for free, but we're co-paying from our employer or the state, and we still don't go. Back in your country, they only went because they had to.
Yeah.
They were pretty much near death at that point because they had no money to pay for it and they had no insurance.
Yeah. That's the big difference right
It
there.
really is.
Yeah.
It is. Well, thank you about that. So as we think about elevating your value, and here we're talking about how do you elevate, the value of your health.
Mhm.
When you think about yourself, Dr. Obilor, was there any point in time, this can be either in your corporate career or even coming here to the US, where you didn't feel valued? And what did that feel like?
I will tell you, whenever that anyone, and I won't just say anyone, whenever that I'm not valued, that emotional rejection, it's always there. And especially when you know that you're giving your best, and at the end of the day, it's not valued, it tends to demoralize you. It tends to even give you that cold feet to do more. So valuing someone and recognizing the value that they bring to the table, it motivates them to do more. It motivates them to understand that they are doing something meaningful. They are being a part of the big picture. And once you are doing that, the good news is this: as you are even valuing someone, helping them to know that they bring value to the table, you also elevating your own value at that point. Because that is what people don't know. It's not a competition. And some people see it that way. That is why they try to push back or withdraw from making people to know that they are superstars. Because they are afraid that, oh, if I let her know she's high performing now, she's going to be thinking that she is really up there. But that is not the point. The point is that when when we elevate people, we are elevating ourselves. When you make people understand the value that they bring to the table, you are as well showcasing that skills and talents that you have. Because leaders should develop leaders and not followers. And if you are the only superstar on your team, that team is lacking something huge. So it is very important and crucial, both in leadership, both in our professional and individual lives, to help people even see the value that they got, that they can see that they have those values. Help them see the talents and the skills that they have. Develop them to the level that when you are not there, people will remember you for what you have done for them and the impact that you have left in their lives or created in their lives.
Yes, thank you for that. I always say if a person that I've been working with gets promoted, that's great. I'm happy for them.
Yes,
That
yes,
is my legacy on them. They're up and beyond and gone or whatever it is. That's a beautiful thing because I can remember when they came to me for guidance, came to me for to assistance. Something I
mm-hmm.
said sparked an idea that
Yeah,
changed the trajectory of their career. It's a beautiful thing. I'll take credit for that. But some people, you're right, they feel jealous and
yeah,
they want to keep people in a box to say, you know what, oh, I can't let them shine because again,
mm-hmm.
they might get promoted ahead of me. But
Mm-hmm.
leaders understand and senior leaders know that who's leading and creating more leaders and those who are
Yes,
stifling other people's growth. So I
exactly.
thank you. And I thank you that you are one of those leaders that people are drawn to
Thank you.
because you are that encourager. You find the silver lining in what they're working on. Because a
Yeah.
lot of times people are not quite sure.
Mm-hmm.
They come to work every day, they do their job as prescribed on the piece of paper,
Yeah,
but they're not quite sure where are they adding value. They're not
exactly.
quite sure how did what I do today make a difference. So
Yeah,
I thank you for empowering others to understand what that is
sure.
so that you are leaving your legacy. I appreciate that.
You're
Appreciate that.
welcome. Yeah.
So, how do you leverage your uniqueness? So, you have this beautiful background, you're very educated. How do you leverage that uniqueness to ensure that people still know that you're Stella? You are warm, you're welcoming. You can come talk to you about anything. Again, even though we have lots of recognition, we're still human beings. So, how do you really leverage your uniqueness in the workplace?
Oh, thank you so much, Dr. E. And that is something that I feel passionate about whenever that I have to talk about it. You know, one thing I know that really has helped me so much to leverage who I am, my personality, where I have gotten today, the heights that are where I am right now, it's empathy and compassion, right? I believe so much that the title that I have today, it's nothing without people. And that's why for me, I don't crave for leadership. I don't love leadership, but I love people. So what comes first for me? They are not the letters behind my name, not the job title that I have, but people. Because one, I want to lead them with compassion. I want to lead them with empathy. I want to value them first. And I also want to be vulnerable. I don't want to create that wrong impression that I know Stella is a high performer, overachiever, meet targets, meet deadlines, but I don't want people on my team to see me that she does not make mistakes. She's a superhero. Everything about her is perfect. No, I am vulnerable to allow people to also be vulnerable. When I make mistake, I take accountability of that and tell you, oh, I'm sorry, this did not work so well as I thought it could go. This is what I did, and I believe I didn't do it so well. Next time that I want to do this, I want to do it this way, right? I am that individual that it's easy for me to acknowledge when I've made mistakes. It's easy for me to be vulnerable when I have to be vulnerable. So you open up time for, open up that avenue and build and nurture the culture that will make people see you as a human being. I lead with a grain of nature. And that has allowed people to come to me. That has allowed people to share their feelings and difficulties and challenges with me because they have seen me sharing mine. I did not just fall from heaven. I belong here. I'm a human being. I also have challenges. We are all work in progress. And that's why leadership has no limit. It has no cap. Every day leaders are learning. If you stop learning, you stop leading, right? So with that, I have leveraged my unique personality so well. I don't push people away. I accommodate people. I help them to identify, even in them, that they are also human beings, right? Yeah.
Thank you. Thank you. I love that. I love that. Say, yeah, I didn't just fall from heaven. It
Yeah.
might look like it, but I
I'm
didn't.
here. I belong here. Don't mind me with all my letters behind my name. That doesn't mean anything. Stella is still vulnerable. Stella is still open to share her mistakes and where she hasn't done so well, so that people also will learn from that. Yeah, I think
Yes.
that is very important.
That is, I love that. It's the compassion and empathy. So those of you in the audience, make sure you're writing that down. Empathy and compassion. And it doesn't matter how many letters you have after your name, people are people and we are human. So please don't
Exactly.
feel afraid to reach out, ask a question, send a note. We are very open.
Yeah.
So my next question for you, again, Stella, we know because you lead with empathy and compassion, people are constantly coming to you
Yeah.
for counsel, if you will. So what's the most popular problem that people come to you with?
Oh, wow. I would tell it's like whenever that I have to speak to most of my mentees, I have realized, especially women, they are afraid to share their accomplishments. And some will ask me that they feel like whenever that they are sharing their accomplishments, that people will see them that they are arrogant or that they are overly proud, right? But I mean, I have always educated them when it comes to sharing your accomplishments. Now, look at it this way. If I am in a corporate society, in a corporate space, corporate environment, right, where I know that I cannot grow except I have mentors, except I have sponsors. If I have to have a sponsor that will work well for me, that will speak for me behind the closed doors, it's like you cannot give what you don't have, right? That sponsor of yours cannot speak well for you if you have not, if you don't have enough currency. They're gonna spend from your currency, not from theirs. What they know is what they know. Good for them. But if they have to speak for you behind the closed doors, they're gonna speak off of how much they know about you. What are your accomplishments? What are the projects that you worked and you achieved and you met the spotlight? And now tell me, who has the skill to read anybody's mind? I am very smart, but I don't have that skill. I can't read anybody's mind. So I tell people, especially women, don't be afraid to showcase your accomplishments. Don't hide your talents because you don't want people to know much about you. And again, remember, nobody knows if your shoe is pinching you except they are wearing the shoes with you. So you can be your best cheerleader, but do it in a way that is professional. Do it in a way that your humility is there. I remember one of my leaders that I had in the past, like 4 years ago. After my evaluation, he said to me, Stella, you are very knowledgeable, but you are humble. That is one of the best comments that I received from one of my leaders. Because Stella is the best cheerleader of herself, but I do it with humility. I do it still letting down my leader or whoever I'm speaking to tell them that I'm still learning. Nobody has all the answers. By the time you think you have all the answers, you're missing opportunities. So people should not be afraid to showcase all the talents they have. People should not be afraid to Please, sweetie, nothing is wrong about you picking up that trumpet and say, oh, if nobody sees this, pam, 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 this is me. Yeah.
Yes. And especially as women, we have so many different things we've done. We may have had several different changes in our lives and what we do, and our current boss may only know the handful of things that we've done for that individual.
Yeah.
But there are so many other things that we've done in the past, and if we don't talk about it, we may miss out on an opportunity to be able to leverage that back into our daily workflow, or even move back into or move toward an area where it might be more of a passion today. So I
Okay.
appreciate that. So those of you in the audience, make sure you toot your own horn.
Yep.
I love that. Thank you. Thank you.
Yep.
And just to think of the parallel on that about being humble and women not wanting to share, do you think it's because they want to keep kind of their life separate from work, or are there areas that they may be afraid to share or ashamed to share? Why do you think that women are not wanting to toot their own horn?
Yeah, and I tell you, sometimes I don't blame them. I can feel bad when people share their stories with me, right? And I'll give you one example, or maybe let's do it as a scenario. If I'm your leader and I ask you maybe during my one-on-one with you, are you okay? You said you're not okay. And I said, okay. And I move on, and that one-on-one goes on. Do you think that another day when you ask me if I'm okay, even if I'm not okay, I'm not going to tell you that I'm not okay? Because the last time that I told you I was not okay, you did nothing. So that you can relate that to this, right? Some women, when they shared their accomplishments, when they were blowing their horn, or when they shared whatever that they may have shared in the past, the response they got was not favorable. Some have been tagged, oh, aggressive. Some have been tagged that they are very proud. Oh, they always like want to showcase all their talents and skills they have. And remember that experience is not something that happens one day. It's accumulation of occurrences. So whenever that has happened to an individual, you see them, they withdraw into their shell. Now they don't want to, even if they are the best in class, it's difficult for them to tell anyone. And that is not good. We should change ourselves when we do that. Because opportunity may come up and someone is behind the closed doors where they have to make that immediate decision. Nobody remembers you because they don't know you for all those talents and skills that you have. And nobody carries all their resume all the time. Even if you do, you may have, like me, I have more than 5-page resume. Some people who will have patience sometimes to read that in a minute. So, but by the time that I'm able to showcase and share some of the, skills and talents that I have, it becomes very easy for people to at least remember you for one thing they know you are subject matter expert on. Yeah.
Thank you. Thank you. Yeah. So, ladies, take a look at your resume. Make sure you have at least on paper all that you've done and all the beautiful lives you have changed and saved in your workplaces. Thank you for that. So, what are some quick and easy things that women can do, especially to elevate their value?
One of the things that I know that I have been advising all my mentees and people that I speak to, or people who are within we call them board of directors, we always have those ones that we run to, right? Please invest in yourself. It may be expensive, but think of what the return on investment will look like. And when people ask me today, I do not have regret over any certifications that I have done in my life. I do not have regret over any degree that I have acquired. If not for anything, please do that for confidence. If not for anything, please do that for your self-esteem. If not for anything, do it so that someone else will have to look at you and do that in the near future, because they believe that if you can do it, they can do it. But investing in our career, investing in even professionally, individually. And I give this example each time that I have to speak, to young young individuals, I tell them, and I'm also guilty of this thing that I want to talk about now. We change our phone almost every year, especially for those of us that are hooked up to iPhone, right? You want to upgrade your iPhone, but you look at your resume from year to year, you don't want to upgrade your resume. Something is wrong with that fellow. We need to upgrade our lives. We need to look into our life and see where we have gaps and close those gaps. So that is one of the ways that we need to elevate our value, is by investing in ourselves. Whether it be webinar that you want to attend, just draw goals for yourself every year. I have to attend 2 webinars in a year. I have to go to workshop. I have to listen to Dr. E, because I tell you, any workshop that Dr. E organizes, if you attend it, you must grab one thing or the other that day before you leave that workshop. So we should know what we want to achieve every 6 months, every 12 months, year after year, especially if we are leaders. Leaders keep learning to keep leading. You cannot impact people if you don't learn every day. Remember that you can't give what you don't have. That is what I tell myself every day. And my happiest moment is anytime that I learn something new. I mean, that is part of how you see all these letters, is that I'm very curious. If I don't know so much about something, it might result to another certification, because I just really want to do something, to learn something new, right? So that is very important, that we continue to invest in ourselves. It may be expensive, I want to say that again, but the return on investment will be huge.
Yes. I love how you said it helps with self-esteem and confidence. And
Yeah.
it's interesting, when I pursued my PhD, I've been working in finance forever, but my PhD is in education because I found passion in that and I wanted to truly develop and cultivate that. And I almost quit many times because you get to the point sometimes where you're frustrated, but I could see the light at the end of the tunnel. So I finally finished. And then I'm very humble about, well, should I call you Dr. Carter? Like, call me Elizabeth. And everybody's like, no, you earn that, doctor. You let people call you Dr. Carter, Dr. E, Dr. Elizabeth. And so I'm very humble about that. But you're so right. I've made the investment. I should showcase, because that's purely shows the determination, the resilience, the persistency to
Exactly.
get it done. And I do feel more confident when I talk to people about so many different things, not just finance. So you're so right
Exactly.
about investing in yourself. The ROI is tremendous. It may
Yeah.
not be immediate ROI, but that confidence, you can't, there's the confidence piece is invaluable. You
Exactly.
can't put a price tag on that.
Yeah.
Because
Yeah.
when you're confident, as you mentioned, you can go out into the world and do things that you wouldn't have done because you were
Exactly.
too afraid, you weren't
Yeah.
sure, imposter syndrome. But with those new skills you've learned, and you get to meet people, network. So I thank you so much for that comment about
Yeah.
investing in yourself. You are your best investment. You can
Exactly.
never lose doing that. You can gamble different things away and think something's a sure thing. The only sure thing is yourself.
Absolutely. Yeah.
Awesome.
Mm.
So, how can people get in contact with you if they loved what they heard today? Maybe they are, an immigrant coming here and trying to navigate and would love to pick your brain about some of these things you talked about today. How can someone get in contact with you?
The easiest way for me, I'm very active on social media. Please look for Dr. Stella Onuoha-Obilor on LinkedIn. Please look out for me on Facebook. I'm on Twitter. I am on, Twitter is called X now, right?
Yes.
Yeah, look for me on Instagram. I'm also there, so please. And I bet you I am also very responsive. The rule that I set for myself: no email or no chat or message will be sitting in my inbox beyond 24 hours. You must get a reply from me. Okay? Yeah.
Wonderful. Great. Well, Dr. Stella, I appreciate you and thank you so much for saying yes to being
Yeah,
part of the anthology. Letters to My Corporate Sisters too. Those of
sure.
you out in the audience, if you have not gotten your ebook copy, please go to Amazon and pick it up. You can hear Stella's story about being an immigrant woman and how she has persevered, and you see her here before you today. We appreciate you, Stella, and thank you so much for joining me here today.
Thank you so much,
And
Dr. E.
to my Elevate Your Value audience, thank you so much. Stay tuned for more interviews and videos.
Thank
Thanks
you
so
for having
much.
me. Sure. Thank you.
Thanks.
Bye now.